Let's not normalize these mood swings that come with menopause. Let's not say it's okay. And let's remove all the taboos. Why can't we just go out and speak about, yes, I have a problem and this is my period. Is it normal or abnormal? I think that kind of awareness is the most important right now. It's not, again, one size fits all, wherein which you just take all the 10 supplements that one Instagram influencer tells you to. It's not like that. Or if you're too young, it doesn't mean, yes, everything is right in my body and I can definitely conceive. It's not like that.
I know this is a very vast topic when one says women's health and well-being. So, a very good afternoon, everybody. I am Paloma, and Super Chennai Arattai presents this amazing session where we're going to be talking about balancing ambition and well-being and health concerns of women today. We have with us the lovely Dr. Samhitha Moturi, the director of the Prashanth Group of Hospitals. Welcome. It's wonderful to have you here today. Now, she's somebody that doesn't need an introduction, but we like a little bit of drama, and we'd like to tell the audience a little bit about you. So Dr. Samhitha, she looks really young. I know that's the first thing you're thinking, right? But let me read this out for you. Is a reproductive medicine expert and a certified robotic surgeon proficient in the SSI Mantra robotic surgical system. She has an MS in obstetrics and gynecology and has completed fellowships in reproductive medicine, minimally invasive laparoscopic surgery and cosmetic gynecology. And in addition to her clinical practice, she plays a pivotal leadership role in shaping the strategic direction of Prashanth Group of Hospitals. She's known for her empathetic approach and commitment to clinical excellence, and she's passionate about raising awareness when it comes to reproductive health, fertility preservation, and women's wellness. Can we give Dr. Samhitha a big, big round of applause as we begin today? Welcome on behalf of Super Chennai.
Thank you so much. You did make me a little awkward there, but yes, let's roll with
But
this.
all the truth and all facts. So we're going to be starting or talking about the main subject, which is balancing your ambition and your health, right? So let me get straight to the point. When it comes to women's health, what would you say is the first issue that should be addressed, something of concern according to you?
Right now, when I see a lot of women coming in, the first thing I would say is address your mental health first.
Okay, yes,
And that's the most important thing. And of course, then comes your, the health issues that you talk about. So when I see a woman, especially in the reproductive age, I'm sure all of you over here, I will always talk to you about, please be mindful of your periods. That's very important. A lot of issues stem from there. It needs to be normal. And let's remove all the taboos. Why can't we just go out and speak about, yes, I have a problem and this is my period. Is it normal or abnormal? I think that kind of awareness is the most important right now. And of course, your general well-being after that.
So since you brought up the subject of periods and a woman's cycle, what would you say is the correct age for a woman to visit, say, a gynecologist like yourself? Because a lot of women only visit one when they're about to get married or once they get married, or maybe they're planning on having a child. I have friends who've never gone to a gynecologist except to deliver their babies. So according to you, what is the right age?
See, always I think the clues come from symptoms. It's very important that once you attain your periods, like once you've started your periods, you need to come in when you have a lot of pain. Let's not normalize that. Pain during periods is not normal, guys. Very important. That's one. And the second thing being the bleeding, the amount of bleeding that you have. And I see on a lot of forums when I go, and a lot of people have this, even patients when they come into me, they don't come and speak to you about periods, right? Unless and until it's extremely difficult, when they come into our OPD, they have anemia, they literally don't have, in layman terms, when I talk about, the hemoglobin of about 7, 6 when they're going into heart failure. I've seen many a patient coming in like that. Just be aware, talk about it. And if you have doubts, why don't you just come and visit us just for a consultation? It's not that you're going to have to come in for any tests or investigations, right? Just come and have a chat with us. I think we're all open right now. Just ask all of your questions, however stupid it may be, it's good. Come and ask me. So this is my cycle like, I bleed for this many days, and for the first couple of days I have a lot of pain, or I pass clots. Is that normal or abnormal? I think that's where it starts from, right? And when you talk about a health checkup, yes, of course, in your early 20s, that would be the best time to approach your gynecologist. Just do a normal ultrasound or a scan. Just look at your health, right? Just look at your uterus, ovaries, and how the function is. Do a couple of your blood tests where you check your sugars, your thyroid profile, because your hormonal balance is absolutely essential for health. So let's start there.
Now, the next big topic of conversation is, I think, PCOS, or the newly renamed PMOS, right? So again, there's a lot of maybe misconceptions about it. So tell us a bit about it. Like, can thin women not have PCOS? People with PCOS are usually overweight or look a particular way. So maybe you can tell us a bit about that.
Oh God, that's the biggest myth I've ever heard. Thin women don't have PCOS, or the newly coined term for it is PMOS. And also another myth that I usually, when patients come in and they ask me is that, so I've done an ultrasound scan run and my ovaries are absolutely normal. The doctor, the radiologist or a gynecologist has said normal ovaries on my ultrasound. Can I still have this problem? Yes, you absolutely can, right? Why this term change from PCOS to PMOS is because it is a metabolic disorder. That means it affects your entire body. It's just not your ovaries that we're concerned about here, right? And this is a broader term, and of course, I'm going to have to take in 1 hour lecture on what PMOS actually entails and how the treatment is like. But the most important thing for you is, yes, thin women can still have PMOS and PCOS, and there are specific tests that you can do to find out whether you fall into that category and act early. Because in these patients, majority of them tend to develop a lot of complications later in life, like diabetes. It's not easy to deal with diabetes, guys, So please get tested early. That's the most important thing. And the other symptoms, if I can, just to tell you, like whether you need to get yourself checked early or not, is fatigue, right? You feel tired all the time, even after you have a meal. 2 hours post-meal, you experience that crash. You're just dragging yourself and you're just working with pure grit and your body doesn't seem to cooperate. Those are the kind of things, these are the symptoms that you exhibit sometimes. So please get yourself tested.
Okay, so since you spoke about fatigue and number one, in the IT industry or the ladies or we're talking, right? So maybe you could tell us a bit about that feeling of always being tired. It's something that we have normalized, right? So could you shine some light on this? Oh, IT work was stressful. Yeah, we're always short on sleep, we're always hustling, but all that has a role to play, and maybe you're the right one to shine a light on this.
First of all, let's not commend women for breaking themselves and just working 12 to 18 hours, insane work hours, and doing everything, being present at work, being present at family, juggling so many responsibilities. I think we should stop worshipping that woman, because I feel we should prioritize our health and draw clear boundaries as to what works for you and what doesn't. Not even as a gynecologist, I'm 30 years old. Usually people don't talk about that, but I can relate to a lot of you who are sitting here, right? Let's not normalize this hustle culture. Let's put an end to it and just say that, okay, this is how I feel good. I feel comfortable with this many work hours or comfortable with this many responsibilities, and the rest we're going to have to share, right? I think that's where it should start. And of course, the health comes later on. When you come to us, you get tested, you tell us symptoms. That's much later, guys. First, let's prioritize mental health, because I believe genuinely that's where it starts from. Whenever you guys feel a little low, when you feel like, oh God, I cannot do this anymore, but I'm still going to pick myself off the bed and still go to work the next day, that's when you really need to think about, am I doing justice to myself, my health? That's where it all comes from, and then that's the most important conversation that we should have.
And since you did talk about the fact that you're 30 years old, if a common topic pati pese poro, which is I'm sure at home they would have told all of you, have your babies before you're 30. It used to be 25. How many of you have heard this? Can we see a show of hands? Yeah? It's a common conversation, then. So they'll say, have your babies before a particular age. And again, you're the right person to answer this. This topic of fertility, is there actually a timeline on it? And maybe we can start by explaining to the audience, fertility na? What is fertility?
So fertility for me is an ability for the couple to conceive or to have a child, right? Simply put. And I'm really stressing on the word couple here because it's not just pertaining to the lady, right? It is pertaining to the partner, the husband, right? That's very important that we shed some light on that.
Yeah.
And there is no specific age, guys. You know, when you look at it, even in healthcare, so I've had a fortune of knowing a lot of senior gynecologists that I practice with. And earlier on, let's say 10, 20 years ago, when they started their practice, there used to be a certain age where the ovarian reserve or the egg production rate in the body used to decline. So broadly, we used to define it and say that, okay, maybe after the age of 30 or 35, the egg reserve declines. But that's not the case right now. Because of a lot of things, the environment that we live in, the pollution and the packaged food that we ingest, you know, the microplastics in that, the chemicals used in that, they're hormone disruptors, and all of this stress, we're always stressed, this generation is always stressed, right? That includes me as well, please don't take it personally. So because of all of that, I've been seeing this trend of decline in the ovarian reserve very early on. Believe it or not, I'm a fertility consultant and I've dealt with patients at the age of 20, 21 with very, very low reserve. So the normal reserve when we check for in terms of an AMH, which is a blood test, is about 2.5 to 3.5. Believe me, I've seen people at 22, 23 with less than 1, and it's shocking even to us. But age doesn't matter. Just come and get tested to even plan. It's not that you're getting married tomorrow and you have to come to a gynecologist or after your wedding. It doesn't matter, guys. Just come in, check. General health and well-being is also important, right? So come get yourself checked in early 20s. That's what I would recommend to this generation, this population of people. Early 20s is the best way to go.
Okay, and what would be the solution for something like this? So you've just said that some people's egg reserves are low, and especially with the pollution and the lifestyles that we lead, you find that it seems to be declining. So would improving one's lifestyle help this, or it's a contribution of multiple factors?
Oh, it's multifactorial for sure. It's contribution of many, many factors, right? Okay, can I just have a show of hands as to how many of us regularly work out? And yes, okay, yes, definitely, right? I mean, I'm just for the audience over here. I've had like 2 people raising hands. And how many of us, how is your commute to work like? Do you walk or do you catch a bus or do you
That's
get
a funny
in a car?
question. I don't think anybody walks in Chennai.
Yeah, exactly. So, you know, all of these really contribute, right? I mean, are we really concentrating on ourselves here? So that therein lies your question. It's a lot of factors. It's not just one. And of course, many of women are suffering from something called endometriosis and adenomyosis. Endometriosis especially is such a disease that it eats away at the ovarian reserve, right? And it causes a lot of pain during periods, unimaginable pain, you know, and the reserve drops and things like that. So it's very important that all of us are aware of these things. So always I tell my patients who come in, any time that you encounter your painful periods, don't tell it's okay. Don't swallow pain medication. Just come and get yourselves sorted.
I think this is probably one of the biggest myths that she's busted for me today, which is that pain during periods is not normal. And I think something that all women have had to live with is the fact that this is just how it is, right?
I mean, nobody,
carry on with life, and that's just how it is.
But nobody talks about it,
correct.
Right? We've
Yes.
all been, you know, conditioned that way, where we say you're a superwoman, you're a superhero, you're just going to pop a pill, or you're just going to go to work, stand and be like, you're going to do this. But why, right? Why do you need to suffer?
Yeah.
Let's not do that.
Now, also we hear a lot of women saying, I've been trying to have a baby or I haven't had a baby. Should I take a break from work or should I take a break from my career to make this happen? What are your thoughts on that?
Absolutely not, because again, I don't think I would ever do that. You needn't sacrifice your career to have that. And even in fertility, it's not just IVF, you know. When you come in, please come in as a couple and get yourselves tested. And if everything is okay, you can just, you know, try naturally or whatever floats your boat. And you needn't take some time off work or you need to be on complete bed rest. That's another myth that I always hear from women, that you can't actively function during pregnancy or actively function when you're trying to conceive or when you're trying to have a baby. No, that's not how it works, guys. You can definitely pursue both at the same time, and that's something I've done as well in my personal life. And I think you can do it. If that is what you want to or wish to, you can do that.
And what about stress? Now, we just spoke about stress affecting hormones. So, continuing in that same line, does stress affect the ability to conceive?
See, indirectly, yes, because chronic stress, what it does is it has a lot of impact on all your hormones. And why are these hormones important in the body is if your hormones are normal, in of the normal range, you have your regular cycles, regular ovulation where the egg gets released in the body, and regular everything. So with this chronic stress, lack of sleep, your sleep cycle is disturbed. So your cortisol, there's a particular hormone that just rises in the body, and that kind of disrupts all your reproductive hormones, especially so in women. So as a result of that, you will go into this cycle of irregular cycles, of course that in turn affecting fertility. And of course this has a direct impact on your ovarian reserve as well.
I think I'm going to be dreaming about the word ovarian reserve now. I've heard it so many times today. So, okay, what are the common misconceptions amongst young professionals when it comes to fertility and age? If you could do a little bit of myth busting for us.
Older doesn't mean you can't conceive, or if you're too young, it doesn't mean yes, everything is right in my body and I can definitely conceive. It's not like that. Age doesn't matter.
And when it comes to IVF, we all hear this term IVF, but what should we know about it? And again, what are the misconceptions along with IVF?
Yes, the most important thing I think we've already addressed is, okay, I have made up my mind to get IVF done, right? I'm quitting my job. And that's what a lot of people come and tell me. You needn't need to do that, guys. It's a thing.
Also, like you said, the assumption that if you have an IVF pregnancy, then you need to be on bed rest. Is that a misconception?
Yes, that's the biggest thing that I face every day, where we've heard from somebody on the social media. There's information everywhere, correct?
Yep.
So there's a lot of information everywhere. So that's not true. If you do not have any complications during your pregnancy, you can treat IVF pregnancy just like your normal one, where you can actively work and pursue everything that you wish for during the time of pregnancy. And one more thing, IVF, is it always going to be a twin pregnancy? Again, a big no, not at all.
So that's the other misconception. IVF doesn't always result in twins or multiples. Okay, all right. And then coming back to talking about egg freezing. Now, at what point should somebody be thinking about this? I mean, a lot of articles say that India is one of the best places in the world to have something like this done, both in terms of the level of care, the quality of doctors, and also the price point.
Yes.
So, what are the different stages where somebody might consider something like this?
See, again, it all starts with how good your reserve is and when you're planning to have a child. Those two are the major factors that are driving this. And see, when I really do treat a lot of women in their 20s and their early 30s when they walk in, and they do share a little bit where they are really under a lot of pressure from the society to get married at a particular point of time. Because somebody told them that you need to have your child before the age of 30.
Yeah.
It usually doesn't work like that. That's one. And number two is, of course, your career.
Yeah.
When you prioritize your career, sometimes you might have to, push things a little, further and say, okay, maybe not this year, let me prioritize on this first. And then I will think about a marriage, or even just fertility in general. So I think these are the factors. And comes to India and price points, yes guys, of course, we have the best treatment that is available in India right now. And when you even compare to the most of the developed countries with amazing healthcare out there, time is very important. I have a lot of people coming in from countries like UK, Australia and Canada, where a couple goes in today or a person goes into the OPD today, and they're called for the procedure of IVF 6-7 months later, right? Because they have a system, you know, the NHS system where, you know, this is all elective procedures. This is not an emergency. But in India, you can walk in at any point of time. You probably have hundreds of options, if I may, and you can just choose your doctor. There's a lot of information. You can choose your doctor or choose your gynecologist that you're comfortable with, and you can embark on this procedure right away. And I think that is the biggest goal. I think a lot of people don't realize this about being in India. The access to healthcare is so easy.
Yes.
Right? And of course, the price point. I think I've had many a patient just flying in for egg freezing or for IVF because they probably were not able to afford that kind of healthcare in their part of the world.
So I think what we should do is we'll open the floor for questions and then we'll sort of come back and end it with Dr. Samhitha. So ladies, you're not going to be able to get a chance like this and somebody so happy to answer your questions and giving us her time like Dr. Samhitha is today. You can ask the question in English or Tamil.
When we speak about the supplements, in recent past I am hearing about many things, especially being a vegetarian woman, they say that you are missing out protein, omega-3, B12 and whatever. So, what is the myth and facts around that supplement?
I think this is a big question and I'm going to ask it again on the mic, which is every second video on Instagram these days is about women having to take supplements. I love how the whole audience is saying yes, magnesium, omega, B12, calcium, like I have folic acid, I have lost track. Right now I've just given up, I take nothing because vitamin D, I mean, where does the list even end? Please set the record straight and tell us, how does one go about this? Doctor, please tell us.
So it's not about the cocktails of vitamins that you take. It again really depends on the symptoms. But one supplementation that I really do recommend a woman in the reproductive age group especially is vitamin D. Very important because you know how all of us naturally get vitamin D. None of us go out in the sun. Or even when we go, we have about 2 coats of some Korean sunscreen which is supposed to work, right? So definitely you're not getting your vitamin D fix at all. So I think that's where you start, right? And see, it depends on your symptoms, right? Chronic fatigue, are you feeling dull, tired all the time? Or if you have like a particular deficiency in the sense, vitamin B12 deficiency, you have a couple of signs and symptoms. Depending on that, it's not again, you know, one size fits all wherein which you just take all the 10 supplements that one Instagram influencer tells you to. It's not like that.
But what I've been seeing a lot of late is somebody saying, I've been taking this magnesium, you should try it. My friend literally came to me and said, I am taking this iron supplement, you should try it. I said, but I am not deficient in iron. I said, I've literally had my hemoglobin is fine and my ferritin is fine and I don't need the iron. But the fact that a friend would tell another friend, take this iron supplement is mind-boggling to me. So do you recommend a basic blood test before getting into this?
Please, you can get yourself checked for vitamin B12 levels, vitamin D, your iron, hemoglobin. All of that, please get yourself
checked. And
checked.
again, it doesn't get simpler than India. The technician will literally come to your house with just one blood test. All of this can be done and that is amazing, right?
Absolutely. And it's quite affordable as well, you guys.
Yeah.
They kind of package it very nicely these days.
So, to answer her question, she's saying, you are wanting to know what supplements do you actually take. So, to sort of your takeaway from that is, first of all, figure out what you're deficient in.
And then
a simple blood test. And please guys and girls, just because your friend is taking something, please don't automatically take it, right? So make sure that you're deficient in something and your doctor says you need it. Even a regular GP could probably help you with this.
Yes, absolutely.
You know, then you take the particular supplement. But if there's something that women should focus on, what would those parameters be according to you, doctor?
Definitely iron, and it depends on the age group where you're at, right? A lot of adolescent women tend to have a little heavier periods. At that point of time, I always recommend iron supplementation and vitamin D supplementation. When you're looking at perimenopausal or menopausal group where you're going to stop having your cycles and things like that, calcium is your best friend at that point of time.
Okay. Does it answer your question? You feel, I feel you have a follow-up question. Go ahead. What is it?
No, I was just thinking nowadays they are not saying that if you have this deficiency, you go for this supplement. They say take this supplement, your skin will glow. Take this supplement, you will sleep well. That kind of
Trust me, it doesn't work like that. And I'm also a very firm believer. I've had a lot of patients come in and tell me, doctor, you don't give me medicines at all. I'm a firm believer that it has to be a holistic care, and it's a concept of, holistic health. It's not that I write a tablet off on my prescription, it miraculously will cure you of every symptom that you're experiencing right now. So I think it starts with, of course, finding out what the problem is, taking care of the said problem with a particular supplement or a particular drug that is going to help you, and of course the mental health as well, that plays a vital role in women's health.
What's your name?
Anbarasi.
Anbarasi, that is what we call a hook. If they told you take this to be healthy, you wouldn't have stopped and watched that video. The moment they said your skin will glow or you will sleep well, see, you remember it, right? That's all it is. It's just a hook.
So my biggest fear is about menopause, because I have never seen any of my women in my family, like my mother, mother-in-law, all of my aunts, never visiting a gynecologist for menopause. But now there are many terms and awareness going on, right? Because we use many, Google searches and all, like there's menopause, perimenopause is there. So when should we become alert of that? Because I feel like my cycle is actually not regular right now. So there can be other reasons, but should I be considering this, and can you give some awareness on that?
Yes, of course. So, see, your menopause actually depends on, whenever a patient comes in and asks me the same exact question, your menopause actually depends on when your mother or your elder siblings attain menopause. It will be usually around that time. That's number one. So that's your first clue, right? Okay, so my mom had attained menopause at this particular age, and I might, it's not set in stone of course, that I might attain menopause at that period of time. And always, why is there so much awareness happening right now regarding menopause is because the most important thing is we're seeing a rise in a lot of endometrial cancer or the uterine cancer. That's why this awareness is quite important. And of course, your cervical cancer, India especially has seen a very recent rise in a lot of cervical and endometrial cancer. That is, cervix is the mouth of the uterus, and of course the uterus as such you would know. So it's very important that when you have your irregular cycles for prolonged period of time, let's say 6 months, 8 months, you have irregular cycles, you say you have cycles every 2 to 3 months in that age group, or you have some brownish discharge in between cycles, you have some vaginal discharge which you can't explain, which you think, see, a woman knows, guys, we know. If something is not wrong, you will definitely know, right? If you think this is a little abnormal, right, that is the time that you come and approach us and just get a simple scan. It's not that, see, I know a lot of people who are a little apprehensive. Even in my own family, we have about 2-3 doctors. I still have a lot of my family members, oh, do I have to come into Prashanth really? So it is natural, but when you have these, just come in and
it would also be helpful if more doctors were like her, right? I can't imagine most doctors saying, come and have a chat with us. So I think that is also very encouraging to have a doctor like you who would take that time, answer a patient's questions and not make us, like you said, feel like, oh, is this a dumb question to be wasting the doctor's time with?
I actually believe that this generation of people that, see, information is everywhere, guys. You're not going to come in to get information from us.
Yeah.
Definitely, right? It's available everywhere by touch of your phone. I think we're there to just guide you in a correct path. So, to answer your question again, when you have all of these symptoms, just come in for a regular screening and a health checkup. And of course, also side by side testing your hormone levels, like let's say a thyroid profile is also extremely important. So once we take all of this and everything is normal, then I don't think there's anything for you to worry about in that perspective. The second, the one thing that every one of us are worried about of menopause is the mood swings and how difficult it is. The energy levels suddenly decrease and things like that. There's always help to be sought. Even calcium, you would think that it's just calcium or vitamin D supplementation, but it's done wonders for my patients in menopause. And if need be, we can supplement you with some hormonal pills as well to just help you tide those 1 or 2 years over so that you feel a little better and you can continue having a good normal life that you're comfortable with.
Thank you. I have another question. Yes. I'm also mother of girl child, so yes. She is now 9 years old. So like I am hearing a lot of early puberty like happening in girls, right? So like how can we make sure that I give better health to my daughter so that she doesn't face any difficulty?
Oh, thank you so much for
Plus
that
one,
question.
plus one. I also have a daughter,
Thank you so much for that question, actually. It's so important that mothers or even parents in general just focus on that. So early puberty is again of many reasons. The diet we put into our children is very important. You have to be very aware. I'm not just going to generalize and say eating out is not good, but I'm going to tell you that packaged food with a lot of salt content, with a lot of anything, see for me, my general rule in my household is anything that comes out of a tin or a can with a lot of salt content is not going to come into the house. That's where I start
Good
from.
rule.
And it's not a very strict diet also. It starts with that. I'm sure we all know about a good balance between vegetables, fruits and good meat as well. And the second one is your exercise. Please prioritize on that. One thing that's really held me in good stead, so I'm a mother of an 18-month-old, and one thing that's actually...
Can we give her a round of applause? Wow!
So,
Wow!
that has held me in good stead
Wow.
is playing a sport, right? Playing a sport, any sport. If you're comfortable with going to a gym, yes, please go ahead. If not, also play a sport. Be physically active, because trust me, even if you inculcate at this age, at 9 or 10, that's going to carry on for the rest of your life, because it's very difficult to be in your 30s or 40s and come up with a new habit, right?
Yeah.
So these two things will hold you in good stead. And of course, when you speak about that, please get your daughter vaccinated against cervical cancer. There is against HPV virus. So the injections that you can use is Gardasil vaccine that is available. Very important, guys. Please get them vaccinated, because this is preventable and that's in your hands.
Could you shine a little bit more light on the cervical cancer vaccine? What is the minimum age and what is the cutoff? If you could share with the audience.
So actually,
they keep increasing the cutoff age.
yes,
So I'm not sure what it is right now.
So when we were,
They used to say 25, but I think now it's 45,
it's
so I'm not sure.
It's not. So they used to say 25, and then they used to come up with this cutoff where till they're, they are sexually active and things like that. But nowadays, cutoff doesn't exist. You can get yourself vaccinated till you're 45. Very important. And it's not one single dose, it's 3 doses. You have to complete your course, right? To have some immunity against cervical cancer.
And what is the minimum age for people who have, say, young daughters? Is there a minimum?
I would recommend 12 to 15 years.
Okay.
12 years to start with, yes.
Thank you, Dr. So that was my next question, but you already answered that.
Thank you.
I'll definitely consider this.
I'm so glad you asked me that question though. Thank you.
So I have a very common doubt. The thing is, in our early stages of periods, during my teen age, so it's been 12 years now. So at those days, it will be like 5 to 6 days, 4 to 6 days, my one cycle will be there. Recent days, I'm 26 now. After my 23 or 24, that's why I noticed it's like minimum of 3 days. And in the 4th day, we used to get very little spots. Is that normal? Or
See, absolutely normal. Slight variation is normal. One thing you should be worried about is when you change a lot of pads in one single day, completely soaked, that is. more than say 5 pads in a day, you should be a little worried about, because your flow is little more than normal, and of course when you pass clots. Otherwise, the number of days that you bleed for doesn't really matter, but just in case, you can get yourself checked to just an ultrasound, and the thyroid profile is very important when you have to think about your period and period cycle, because thyroid hormone profile is very important. Just get that sorted, but this is okay.
So, my second question, 25 days is the normal cycle, right?
See, it's not set in stone. For some women, it's at 24, 25 days, and for some women, it is 30, 35 days. So broadly, as a gynecologist, we accept anywhere between 25 to 35 or 28 to 35 day cycle is considered normal, provided that you don't have any other symptoms that I had just mentioned. It's considered normal. Can I just add one single line over there? See, it's very important when we have this conversation, and I see a lot of women in the crowd. I always believe that we should call men as well to these conversations.
It should not be a secret
awareness.
conversation.
Exactly, right? The minute we've all grew up where you have to go and pick up a sanitary napkin, and it's always wrapped really tight and put in black bags and just hand it over to you like it's a thing. It's not, guys. So I always believe, especially in my household, and what has taught me is, we used to have this discussion. I have a younger brother. We used to have these discussions, which as and when, before him as well, to just make him understand that women actually go through this, and it's very important for you to just help them a little bit. And that awareness goes a long way. So please have these discussions. It has to be a family thing. It has to be a friend circle thing. It's not just a women clique. It's not like that.
Yeah. I think the younger generation of girls and women are becoming much more open about it.
Yes.
I think a friend's daughter needed a pad, and her mother came and said, "Here's your pad." She said, "Why are you whispering?" And I think that is something that is so ingrained. Maybe not you, I'm a little older, but with my generation of women, but it's great that it's no longer a taboo,
It still happens.
Periods are a bodily function, just like anything else, and we should talk about it. So I think
we should as well. Like, how many of you have seen ads growing up where there's always blue blood supposedly being dropped on a pad, and I'm like, why is this even happening, right?
Yeah.
Why don't we all talk about it and chat about it and tell people what is normal and what is abnormal? And of course, that's the most important thing.
And all you moms of daughters, I think that's a valid point, right?
Teach them what's normal.
Yeah.
It's very important that they know it from you rather than another source, right? Teach them what's normal. Even your son at home, teach them what's normal.
Correct.
So is there a difference between PCOD and PCOS?
Oh, not at all. Actually, both the terms are redundant now. There is a new term which is PMOS, which says that it is a metabolic syndrome. It involves the entire body. So there's some difference.
So basically, I think what people are trying to understand is that a scan can show that you have no cysts. So that's why we call it PMOS, right?
Yes,
correct?
exactly.
Okay.
So the women will be experiencing all the symptoms, but we do an ultrasound and the ovaries are normal, and we tell them off, say, no, you're absolutely normal, you can go home, but it's not the case. There is some other blood test that needs to be done to diagnose the woman and then treat her.
Another question, like, can PMOS be managed with lifestyle changes, or it should always be involved with medications?
See, even when you come in, even for reproductive function or fertility, the most important thing, or 50 to 60% of the management, is lifestyle management. And when I talk about lifestyle management, I really want to bust a few myths over here.
Please do.
Where they come in and they're like, I'm exercising regularly, doctor, but my symptoms don't subside. But what is that said exercise, right? It's 30 to 45 minutes of brisk cardiac activity or aerobic exercise. It's not that you take 1 hour to walk a kilometer and tell me that this is going to help. That's number one. And a balanced diet. Believe it or not, I've had to deal with some patients who had come in and said, so I saw this Instagram reel which told me to eat sprouts. And I've eaten sprouts for 1 month. Believe it or not, this happens to me on a day-to-day basis. And where they tell me that it's going to miraculously cure my PCOS or PMOS, that doesn't happen. It has to be a combined effort, right? It has to be exercise, it has to be your diet plan, not something that you obtain on the internet. Please come in, check your BMI, check what do you require in your diet, get your blood test sorted. what are your deficiencies, your vitamins and the balance. Get a proper meal plan from a certified nutritionist first. And then you start. It's actually a combined approach. So most of the time when your lifestyle is good, you're good on the meal plan and you're good on the exercise, it just subsides and you will go back to normal. And only in certain cases that we actually intervene and tell you like this is the way to go. But most of the time it's just lifestyle management.
Yeah. Can you throw some light on the menstrual cups that people use? Because it's not very common and we still are scared of that. Are we good to use that? Is that hygiene way?
See, yes, it is good. You know, there's something to debate on because I always tell my patients that whatever you're comfortable with is what you have to opt for. The one thing, it can be a tampon, it can be a pad that you're comfortable with, or it can be a menstrual cup. The only thing about a menstrual cup is you will have to, like, let's say 4 to 5 hours, you will have to dispose of and then reinsert it. And it's very important that you insert it or do this in a very hygienic way, because if you don't do that or your cups aren't washed properly or sterilized properly, there is a lot of chance of infection happening to your reproductive system. It's called, pelvic inflammatory disease, which is not good, right? So that's the only thing, that you know exactly that what you're using, what are the precautions that you need to take, and that's where it stems from. And please don't listen to "take one for the environment" slogan. Please don't. Do whatever suits your needs or whatever fits you. I think you need to prioritize what is comfortable for you when you embark on this journey.
Okay, actually I thought we had quite a few very,
Yeah,
very
it's quite
good questions from the audience and across the board. Do you have any, last bits of light you'd like to shed on perimenopause, which again seems to be the raging topic across the
Right
internet?
now,
It seems like
yes.
as soon as somebody's just had their baby, the next topic is, are you in perimenopause? It's like, didn't I just have the baby? So maybe you would be the right one to, again, do some myth busting and before we wind up, shed some light.
Yes, absolutely. So perimenopause stage, see, age again, late 30s is when you need to be concerned about, early 40s. And some women actually have menopause even after the age of 50. The only thing that you can do is get tested, and especially in your late 40s when you see a lot of the cycle irregularities happening to you or some unexplained discharge, it's very important that you get tested and rule out cervical cancer as well as endometrial cancer. That is something that you need to prioritize. And the second thing is, let's not normalize these mood swings that come with menopause. Let's not say it's okay, your mum and your grandmom has dealt with it, you should also deal with it the same way. It's not like that. If you do experience a lot of these, a lot of issues, right, vaginal dryness, itching, mood swings, a lot of women develop these urinary symptoms where they have increased risk of infection. So when all of these are there, just come in, and even for your hormonal mood swings, there are tablets, there is some form of estrogen supplementation or progesterone supplementation that can tide you over and that can relieve you of these symptoms so that you can lead a better life. Let's not say it's okay, let's not normalize it, right? And there is treatment for all of it. So please don't be afraid to just reach out to somebody to help you out.
So big thank you once again to Dr. Sam, as you are affectionately called, for joining us here today. I know this is a very vast topic when one says women's health and well-being, so it's a tough topic to even give, some closing remarks on. But if you could, in closing, say something to the lovely audience that we have gathered here, what would you say to them before we let you get back to your busy work?
Yes, well-being always comes with, the first thing is mental health.
Yeah.
So as women, don't even look at me as a gynecologist sitting here, as your fellow women and your colleague. All of us have work, all of us have family, all of us have kids, we prioritize few things over others. Let's prioritize on mental health first, and of course your physical well-being as well, because many a time, even now I used to be very active, and now I sometimes feel like I don't have enough time to go work out or do things that are physical, but those things are very important. And please do concentrate on your nutrition. It's important that you have nutritious diet, and your BMI helps, right? Your weight range is also quite important, because I'm not talking about the physical appearance or the looks. It's very important that you feel confident and your body should be strong. And to just be able to do whatever you achieve to do, right? That's the most important thing.
So thank you so much for joining us here with Dr. Samhitha Moturi, the director of the Prashanth Group of Hospitals. And we hope you had fun and learnt a lot here at Super Chennai Arattai. Thank you, and we'll end with a big round of applause for Dr. Sam. Thank you so much.